you for opening us up. And so next, we will have Dr. Angela Kaida, who's a scientific director for the Institute of Gender and Health at the Canadian Institutes of Health Research. This is a global health epidemiologist and community-based researcher at Simon Fraser University. Dr. Kaida is an SFU Distinguished Professor of Health Sciences. She leads a global research program focused on factors and environments that increase vulnerability or protect sexual and reproductive health in the context of HIV. Dr. Kaida works closely with community leaders and decision makers to integrate research evidence into health policy and programming, attending to social and gender equity. In 2022, she was elected as a member of the Royal Society College of New Scholars, Artists, and Scientists. Please welcome Dr. Kaida.
Okay, great, thank you. Okay, good morning, everybody. I'll be like you. Good morning, everybody. Thank you so much for inviting me here today to share some of our experiences in the Canadian context. So my name is Angela Kaida, as Irene has said. I am the scientific director for the Institute of Gender and Health at the Canadian Institutes of Health Research. I live, work, learn, and play in Vancouver, Canada, on the unceded ancestral traditional territories of the Coast Salish people. And I want to do something, we don't have all the time in the world, of course, but I want to do something today, just take you on a brief journey with me. I want to talk a bit about how we've come to understand the problem of non-inclusive research that doesn't include sex and gender at its core in health. Talk about a policy that we implemented and have been measuring and following over time to do something about that problem. I'll share some data with you. Also talk quite honestly, I guess, about some of the gaps that we see as, within this policy, some response, and talk a little bit about how we see the future of advancing women's health research in Canada. Is that okay? You think I can do it? We'll see. So I have to start by orienting you a bit to the Canadian Institutes of Health Research, or CIHR. We are the National Health Research Funder of Canada. Some of the numbers, I'm just going to say the financial numbers I'm going to present to you today might be a little bit surprising for those of you who are environments in the US, but our annual health research budget for the entire system is about $1.34 billion. That's across all disease conditions, across all health issues, biomedical science, population public health, clinical trials, etc. And we're composed of 13 scientific institutes, of which the Institute of Gender and Health, or IGH, is one. And we have a mandate. Our mandate is to identify pressing health priorities that are affected by sex and gender, to do the work of sex and gender science, and then to apply what we're learning to improve the health of women, men, boys, girls, and gender diverse people in Canada. But that work can't really happen if we do not have sex and gender variables in our health research across the country, because who we include in research deeply, deeply matters. And many of the gendered health inequities that we see today are really attributable to our historic reliance on a scientific evidence base that is biased, that is non-representative, that is largely driven by research done on male cells, male animal models, and men's experiences. And we do this research, and then we wave hands, generalize to women and gender diverse people, and then sort of feign surprise that it doesn't work as we thought it was going to, or that we still continue to see many gaps. And the consequences of this are huge, and Catherine and Ayodola have already outlined many of these consequences. But really, that this underrepresentation of women's bodies and experiences in our health research database is contributing to this women's health gap. As we've already heard, women spend about 25% more of our lives in poor health relative to men. So while we have a longer life expectancy, this is 9 extra years in the experiences of poor health. And we've already heard these numbers of 75 million years of life lost every single year. And we know, we can quantify that how much of this gap is due to a scientific evidence base that we're not generating or we're not mobilizing into effective drugs, treatment, diagnostics, policies, etc. And so, this is the recognition of this is obviously not new, but the responses that different countries are taking are very different. And for us in Canada, back in 2009, the Government of Canada's health portfolio implemented a policy that was about sex and gender-based analysis. They said, as we design our policies, our services, our programs when it comes to health, it needs to be informed by an analysis that takes into consideration differences or similarities between men, women, and gender-diverse people's health. But you can't really mobilize a scientific evidence base that doesn't exist, right? So if we have an evidence base that hasn't accounted for sex and gender-based differences, how can our programs and policies be informed properly by that evidence base? And so at the Canadian Institutes of Health Research, we're a signatory to this policy, so we implemented a mandatory policy. We said, every single researcher, health researcher in Canada who is seeking funding from CIHR has to talk about what are the sex and gender considerations of the research that you are pursuing. So we can ask people nicely to do that, like, please, sir, please integrate the women into your studies, integrate male and female cell lines, bring in the female mice. But it's that cajoling, I think we all understand, does not work. We had to make it a policy, okay? So this is what the form looks like. You're doing active transportation research, you're doing vaccine uptake research, you're doing cancer research. It doesn't matter. You have to answer this question. What are the sex and gender considerations of your work? And so when a couple of years later, we took a look at, hey, what's happening with the policy? Is it changing? Is it increasing the proportion of our research investments that are considering sex and gender? And like, not great, So what we saw back in 2014 is that we had 31% of our research investments considered sex, and 19% considered gender. I can talk later about why we see that difference. But, not good. So we had to undertake a whole series of additional interventions. We had to tell our research community why this was such an important policy for their own research, as well as how to do it, right? So doing sex and gender integration in your research is not obvious. It takes a skill set. There's methodological work. There's a research on research learning that we could implement. And so you can see, I won't go through every intervention, but really it was about coaching, training, supporting our research community to do this work and to do it better. And then we, as a researcher, your career and your life is in the hands of peer reviewers, right, to understand the importance of what you're doing. And we turned our attention to peer reviewers, and we said, if peer reviewers don't think it's important to do sex and gender for better science, our research community is not going to do it. And so we introduced a mandatory assessment of sex and gender by our peer reviewers. So now anybody who's reviewing this research has to look at the sex and gender considerations and assess, does this make the work stronger? Is it a weakness, or is it just simply not applicable? And then we said, it's not just a checkbox exercise. Weak integration of sex and gender into your science is weak science. It's not an add-on, let's check this off over here. So integrate your assessment into your score, right, for this grant application. Okay, so when we did all of these interventions, this is what we started to see. So this is our recent data from 23-24, where now we're up to 83.5% of our applications considering sex and 46.7% gender. I mean, I think you can hopefully agree with me that that's important, right? That's important. And moreover, when we talk about how is it improving the science, what we're able to show is that when our reviewers score that sex and gender of an application is a strength, your odds of being funded are much higher, right? Better sex and gender integration is better science. And for sex, if all three of your reviewers say, hey, this is a strength of this application, you're 5-fold more likely to get funded. This is very compelling data for our research community, right? That it matters. So what we're trying to do here is we're trying to make the research that we fund better, more accountable to our tax-paying public, and more applicable, right? So that we can apply what we're learning through research. So this was my good news part of the story. Okay, so I think what we can probably agree on, I'm not sure how many people in this audience are researchers, but what we write about in our grant applications and what we do is not always exactly the same. I hope I'm not outing myself in a concerning way, but it's not always the same. Okay, so yes, we have our researchers saying that they're considering sex and gender when it comes to applying for funding. But this is some data from Dr. Lisa Galia's lab, where they went and they looked at peer-reviewed publications at the top neuroscience and psychiatry journals. They said, okay, when we do a review of the publications in 2009 and to 2019, are we seeing changes in how researchers are reporting or including variables of sex and gender and reporting on them? So some good news. They show at first that yes, there's been this quite remarkable increase in the proportion of studies that are including both sexes. Great, important start. But actually, when you go into looking at are they conducting the kinds of designs and analytic approaches that would allow people to would allow discovery of sex differences? They found that that is really not happening yet. And so there's a long way to go in terms of not just including sex and gender and men and women and gender diverse people in your studies, but being able to do the type of research that allows us to see these mechanisms of effect so that we can apply that knowledge. The second thing that they really showed that was important for me in my role was that over this period of time, the proportion of studies being published that were specific to female health actually went down. I mean, it's hard to go down from 4%, but if you can go down from 4 to 3%, you're not in good shape, right? So there's still a gap. This policy isn't helping us close this gap fast enough for women's health. And we really saw that that was replicated in our own data at the Canadian Institutes of Health Research, where this is research over 13 years really showed that still in our funding ecosystem in the open competition, only about 7% of what we're funding is related to female-specific health. I mean, I think that's just an absolute tragedy. And when we looked at what it is that's being funded, it's still quite narrow. It's female-specific cancers, and it's pregnancy-related questions. So the broader scope of what counts when it comes to women's health research is just not being done. And it's not for a lack of talent. We have incredible women's health researchers in Canada, dynamic, diverse, that are working across the spectrum of women's health priorities, but the funding and funding priorities haven't kept up. So we are looking at a women's health research initiative that embraces this full definition of women's health. And what really catches my eye, this is a figure from the McKinsey report that Catherine mentioned earlier, but what I think is really startling here is that about 5% of the women's health burden is related to conditions of female-specific health, right? But about half of that are for conditions that affect men and women, but these are conditions that affect women differently or disproportionately. And there is a desperate need for us to focus there as well. And so in my last couple of minutes, I'll just share that what we've done is we have taken a strategic funding approach, not just letting the grants come to us, but looking for strategy in women's health. And we've implemented the National Women's Health Research Initiative, where we've really thought about how do we get the research that's already out there into the hands of knowledge users, people who can do something with it, as well as focusing on that discovery and implementation side of the research spectrum. So for us, this is our first in a generation investment in women and gender diverse people's health, and we are very keen to build on that. So we're partnering with folks across the Canadian health research ecosystem to offer additional strategic funding. So when the Heart and Stroke Foundation says they want to do something in the next stage of heart and stroke research, we'll partner with them to say, let's focus really specifically on heart and stroke questions related to women. Let's focus really specifically on capacity building so we can fund the next generation of women's health researchers. And so for us, we really have an eye on advancing women's health research through partnerships and through pursuing sustained investment, attention, and the valuing of women's work, our health, our prosperity, and our lives. And I really think that research, we can describe the problem, and research gives us a pathway of how to solve it. Yeah, I'm almost done. And so this is a bit random, my second quote here, but I read this blog post a couple of months ago, and this is a wealth management expert, and she says, we're in the midst of the greatest wealth transfer in history, and women are the predominant benefactor. And when I look at our data on, we've got an increase in women who are health research leaders, who are clinician scientists, who are community leaders. Our next generation is coming up very strong. Let's recognize this moment for what it is and mobilize on it. And so finally, I think for us, if we count women, if we study women, if we care for women, and we include all women and invest in women, we can close this women's health gap. And so I really see the opportunity ahead for us is really laid out. The question is, who's going to seize it? And when are we going to seize it? So I'll just put a call to action to our morning of let that be us and let that be now. So I thank you so much for your time and encourage you to please be in touch with me across the day. Thank you.